Learn about the Optochin test, a key method used in microbiology labs to identify Streptococcus pneumoniae. Optochin general information. The Optochin test is used to presumptively identify Streptococcus pneumoniae, a bacteria that causes various infections like pneumonia and meningitis. This test relies on S. pneumoniae's sensitivity to Optochin, a chemical that inhibits its growth. A small disc containing Optochin is placed on a blood agar plate streaked with the bacteria. After incubation, a zone of inhibition around the disc indicates sensitivity to Optochin, suggesting the bacteria is likely S. pneumoniae. However, some pneumococcal strains are resistant to Optochin, and further testing, such as the bile solubility test, may be needed for confirmation. Other alpha-hemolytic streptococci, which often resemble S. pneumoniae, are resistant to Optochin, making this test a useful tool for differentiation. Optochin. The growth of bacteria that are Optochin sensitive will show a zone of inhibition around the Optochin disc, while the growth of bacteria that are Optochin resistant will not be affected. That is the main reason it is now used in cell culture techniques for the presumptive identification of Streptococcus pneumoniae, which is Optochin sensitive, from other alpha-hemolytic streptococci such as virulent streptococci, which are resistant. Performing the Optochin test 1. Using the inoculation loop, stake 2 or 3 suspect colonies of a pure culture to be tested on 5% sheep blood agar plate 2. Place an Optochin disc, 6 mm, 5 micron, within the streaked area of the plate 3. Incubate the blood agar plate at 35 degrees Celsius with 5% CO2 for 18 to 24 hours. Culture do not grow well in ambient air, and larger zone of inhibitions occur. Reading the Optochin test result 1. Positive. Zone of inhibition is 14 mm or greater in diameter with 6 mm disc 2. Negative. No zone of inhibition 3. Equivocal. Any zone of inhibition less than 14 mm is questionable for pneumococci. The strain is identified as a pneumococcus only if it's bile soluble. History of Optochin. Optochin, also known as ethylhydroxyprene hydrochloride, is derived from hydroquinone. It was initially introduced in 1911 for treating pneumococcal infections. However, its use has shifted to bacterial identification in laboratory settings due to its ability to inhibit pneumococcal growth in vitro. This property allows for the differentiation of S. pneumoniae from other alpha-hemolytic streptococci, aiding in accurate diagnosis and treatment of infections. Optochin test poem. A disc of Optochin, small and white, tests the bacteria, day and night. If a halo doth appear, pneumococcus, it is clear, but if no zone is to be seen, further tests will tell the scene.